Veterans in the tri-state and across the country need help with wounds, both visible and invisible. Learn to spot the warning signs and how to get help for you or a loved one. Welcome to Local 12's What's Happening in Health Veterans Mental Health Forum, sponsored by Butler County Veterans Service Commission, Claremont County Veterans Service Commission, and Xavier University's Captain Phil Bucklew Veteran and Military Family Center.
Well, hello to everyone. We are so glad you are joining us here. We are at the wonderful Xavier University, and we have probably an hour's discussion that could change your life. If you are a veteran or a veteran's family, this is a program for you. It is a mental health forum to address needs in our community and around the area that could make a huge difference in changing lives. I have a wonderful panel here today of people that know all the information that we don't. The great part about this job, for those of you that I don't know, my name is Liz Bonus. I'm the medical reporter here. I don't know a thing about this other than I am a soldier's daughter, and I know that the people that serve our country deserve the very best from us. So I usually can find the resources that know when I don't have the answer to questions. We do have a wonderful audience here today. They're going to interact with us and ask some questions as well. But if you can just take a minute wherever you are and sit and share some time with us, we would love to have you engage in this either through websites or find people that could serve you and your community as well. So let me start right here. We're going to ask our panel, please introduce yourself. Tell us the one thing you find that you are answering the most when it comes to veterans who need mental health assistance.
My name is Eric Stone. I'm a clinical supervisor at Modern Psychiatry and Wellness, and typically what I'm getting asked a lot about is stigma and some of the ways we can challenge it for our local veterans.
All right, so elaborate on that.
Yeah, so a lot of the time people feel that if they're going to counseling, that it is something that shows weakness, or maybe the idea that like if they were strong, that they shouldn't have to be in counseling, but really it takes a lot of strength to go to therapy, to open up and to work on those wounds, and it should be no different than a physical injury or any other kind of injury one would get services for.
Yeah, no question that asking for help thing when you are the helper is very, very difficult.
Yeah, it is. I don't know if it's harder than any of the things the veterans have gone through, though, so I think it's something that we are trained and prepared for. I work as a counselor, so I think it's great to give back in that way and see them able to feel better, go about their day, go back to some of the prior levels of functioning.
Interesting. I don't know. If I've talked to a few veterans who think asking for help is hard, but we're going to continue to elaborate on that. Hello.
Hi. My name is Marie Reinert, and I am currently a student at Xavier University. I am also the president of the Veterans Association here on campus, and I'm pursuing my master's degree in health service administration.
So are you serving in that capacity because you have served?
Absolutely, yes. We really at Xavier try to connect all veterans to a sense of community, and we really try to connect them and be a positive catalyst to them pursuing their degrees here on campus and in the community as a whole.
Excellent. We know we have some wonderful Xavier people here. Pursuing some of those educational goals can change your life, and we're going to continue that conversation. Hello.
My name's Lisa Liston. I'm the Suicide Prevention Program Manager at the Veterans Affairs Medical Center in Cincinnati.
So you used a word that is almost taboo.
Correct.
Suicide.
Yes.
But you're not afraid to use it.
I am not, because I know that veterans, if we can get them connected to care and we can work with them and find out what are their warning signs, what are their risk factors, we can help them recover from suicidal thoughts. So my biggest focus is helping veterans who are at high risk for suicide and helping families in the community understand what are the warning signs so that we can prevent suicide.
Yeah, and that's going to be part of certainly our conversation today. Mike, what a great setup for you. Another person who's just been bold in the message, and we so appreciate your service.
Thank you. Good morning. My name is Mike Farmer. I am the Executive Director of the Butler County Veterans Service Commission. I'm very fortunate to lead a team of 11 employees who really do the frontline groundwork. I'm just kind of the orchestrator behind it to support and give them the resources that they need. So we feel that suicide prevention is the commission has made it a priority. It's one of our 4th pillars. Typically, a Veteran Service Commission in Ohio is focused on service-connected benefits, financial aid, and transportation. We've added suicide prevention as a 4th column or pillar of our service due to the number of suicides that we're seeing in veterans and the fact that in our county, locally, veterans are 4 times more likely to die of suicide than a non-veteran. So we're doing everything we can with connecting with community resources and really trying to meet this head on.
And we appreciate it, but for you, we would not probably have this. He kind of had an idea to start sharing a bold message with our community, and so that's why we're here today.
Good morning, my name is Katie Anderson. I'm the Director of Assessment at Beckett Springs Hospital in Butler County, Ohio. So I work in the intake department at the hospital. We have a specialized program at Beckett Springs called the Help for Heroes program, which serves veterans, active military, and first responders at our facility. We also work closely with the Butler County Crisis Line that answers crisis calls within Butler County 24/7. So I help operate that line, and we operate kind of as dispatch for that line, taking calls in the community, sending out crisis workers to homes or wherever the caller is calling from.
Yeah, excellent program. I've had the privilege of sharing a few stories of people who say they've come through that program where veterans are helping veterans, and what a difference that Heroes program has made. So
Absolutely.
I asked that question to you before, but why is it, do you think, that you need veterans to help veterans?
I think like someone else said, the stigma that is kind of associated with that. Oftentimes we find that maybe a veteran or a service member might be coming in for treatment and is meeting with a therapist and is like, how can you help me? How can you understand kind of what I'm struggling with, what I've gone through? So we have 2 veterans that are the therapists in that program. They have specialized therapy groups to kind of discuss specific issues that are troubling veterans and first responders, military personnel, so that they can kind of discuss those without judgment, without fear of talking about things that might be troubling them.
Yeah. This is a no judgment zone, by the way. You can ask anything, say anything, and other than this wonderful audience that tunes into Local 12, nobody will know. But we really think that no judgment thing is just so important, that you have that freedom in that environment to ask the right questions. Yeah, excellent. And I know you know all about that. You've served and you've seen. Tell us who you are.
Good morning, Liz. First of all, thanks so much for bringing this important topic to light, and thanks to all of you in the audience for being here today. My name is Glenn Welling, and I'm the director of the Veteran and Military Family Center here at Xavier. I'm a Navy veteran, and many, many moons ago, I transitioned from active duty and was a 26-year-old freshman in college. And so one of the things that our center focuses on is helping not only our veteran students make that transition from an environment that they were very familiar with to one that can be very unique and unusual based on their circumstances. But we also do the same for our dependent family members, many of whom, just like the service members, have traveled all over the world and are coming to university for the first time and need our support and build that community around that transition and being successful here at Xavier.
Yeah, no question. And I know from those who've shared with me some of the struggles that veterans have, financially, you know, the burdens pile up, and sometimes if you cannot advance your education, you can't support your family. You got out of the military, now what? And so we applaud those efforts of any university program, but really targeting that population. All right, one gentleman far left.
Hi, good morning. I'm Steve Belzo. I'm the Executive Director of Claremont County Veteran Services. I spent just shy of 3 decades on active duty, Liz, in the United States Marine Corps. I have been engaged with Marines both on active duty and since my time on active duty with suicide. And the military is good at pulling off the scab. We're not going to pay lightly to say, well, this is mental health or something else. Quarterly, we have suicide awareness briefings, safety briefings. We don't play light with it because it's such an impactful event, not only on the family at home, but within a unit as well. And in order to keep that family together, we're going to engage directly to ensure that our warriors stay healthy and that they get the help that they're getting.
Well said. Excellent. Let me just ask a quick question. How many of you have had active service duty or are veterans? And how many out here have had active service duty or veterans? Thank you. Pleasure to be able to have this conversation with you today. All right, couple things. Since Mike sort of started this initiative, I asked him to work with me a little bit in co-hosting some things. And you mentioned there are 4 pillars. And those are excellent conversation, sort of the way we'd like to coordinate this today. Tell me about those 4 pillars.
So the Veteran Service Commissions in Ohio are responsible under the Ohio Revised Code to ensure that veterans and their eligible dependents get all of the benefits in which they have earned and may be entitled. Typically in the Ohio Revised Code, the common ones that you see are service officers, which can help file those claims for service connection, a lot of healthcare eligibility and enrollment forms all the way through the burial process, indigent burial if someone is not able to afford a dignified funeral as their last request, and burial flags. The transportation to and from VA medical appointments is really a key component of what we have in Ohio. I am fortunate in that I also serve at a national capacity as the National Service Director, and not all veterans have transportation to their VA medical appointments. But in Ohio, we have, under the revised code, we're required to provide them transportation to their VA medical appointments. So we're very fortunate in that aspect. And then we get to financial. So we've all fallen on hard times before. It could be unexpected, home repairs, expenditures, storm damage. Things happen in life. And it's important that the commissions are there to help fill that gap and be able to support the veteran or the family member to get them over that hump in an emergency financial situation. So we have funds for that. But at our commission, we didn't feel like just that was enough. That's the minimum that the law says we have to do. And it came to our attention about 3 years ago that there was a problem with suicide in Butler County. And so we started meeting with the Butler County Suicide Coalition, and we kind of had a sub-veterans group. And the more we met, the more it became apparent that veterans, while we're a member of the community, we have some very special needs to address. And we have to go about it a different way. Often veterans connect more with a veteran talking to them. There are certain lingo and languages, and when you're just reading body language or how a veteran connects. So what we did is we work very closely with the Butler County Suicide Prevention Coalition, but we started our own suicide prevention committee. And that allows us to focus specifically on the issues in Butler County. We can monitor the calls, the call volume that's coming into the Butler County crisis line. We also get data monthly from 988. And so if a veteran dials 988 and they press 1, they get the Veterans Crisis Line. And we're doing regular FOIA requests to get that data and to look at how many referrals were sent back to either the Cincinnati VA or the Dayton VA, and what that connection or the possible correlation to then the ultimate act of have we saved a life or do we lose a veteran to suicide. So I'm happy to say that in our suicide prevention efforts, when we look at 2023 compared to 2024, we did have a 20% decrease. 20% sounds like a great number, and I mentioned that one first. But in 2024, we had 7 veterans that died by suicide, and in 23, we had 9. So that 20% difference, it is 2 lives that is invaluable to us in our community. That's 2 people that we can get assistance to. We can help them with all the things I talked about. We can link them to the VA for resources, and we can help them to get help, number 1, but 2, to become re-engaged in the community and have that sense of purpose, whether that's volunteering at some of our events, whether there's just a host of things. So that's 2 lives that were saved, and we're on the right track. So 7 is way too many, 1 is too many, but we are making some progress locally with the efforts that we've done.
Hey, we'll take the 20%. In TV, when we go from an audience of 1 to 2, we've doubled our audience. We're good with that. Excellent. Thank you for sharing that.
welcome.
I do want to take some questions. If any of you have them yet, I'm going to head this way. But I actually want to ask Lisa something. You mentioned to me that you work very hard to help people understand some of the early warning signs. And I will tell you that in my professional career, more than once, I have heard about the loss of a life to suicide and missed those. And I remember that one was a veteran that we did several stories with. It was years ago, and he put up something on Facebook that simply said, "My refrigerator is empty." And I'll never forget it. And a week later, he was gone. And I said, how did we all miss that? Like, we weren't looking for something like that. So are there unique signs that you would say, especially for veterans, that might be a little different than the average, oh, I'm just depressed, or oh, I can't get out of bed, or that kind of thing?
Well, you make a great point. I've responded several times over the years where someone has put something on Facebook or sent something in a text that didn't say, I'm going to kill myself, but certainly alluded to that, or there was some concern. And what I always tell veterans and family members is, if you're concerned, if they say something that you're like, well, that doesn't make sense, or that's worrisome, connect with that person and find out what's going on, rather than to wait and then say, oh my gosh, what did I miss? Because certainly we don't catch everything, right? So sometimes people don't always come right out and say it, but they certainly give signs, such as they might be looking up on the internet how to kill themselves, or what's the most effective way. They might be purchasing a firearm where they had never purchased one in the past. They might actually say that I'm having suicidal thoughts. And sometimes people will think, well, I don't know, does that mean they're serious, or does it mean they just want attention? And I always say, look, we can't read anyone's mind. So if someone tells you that they're having suicidal thoughts, take that serious. You don't have to be the evaluator. We need you to get them to someone who can be the evaluator, which would be coming to the local hospital, talking to their therapist, calling the Veterans Crisis Line. There's many opportunities to get that person evaluated, but don't wait. When you see there's concern, or they make some kind of statement, or purchasing a firearm, giving away their belongings where that would not be a usual thing, then ask that person, what's going on. I think sometimes in the community as a whole, we see people in distress, but we think, oh, somebody else will ask them, or somebody else will connect with them. But I say, when you see the need, it's an assignment for you to say, hey, what's going on? I'm concerned about you, and ask those questions early.
Yeah, well said. On that note, before we go to our audience, I wanted to ask our counselor here. Years ago, I worked with Children's Hospital in some of their training, and they said when someone has suicidal thoughts or they're talking about it, they suggested we actually say, do you have a plan? Because maybe you could interrupt it. Is that still a good way to ask a question?
Yeah, no, I would just encourage asking about it specifically, asking about a plan, intent, means, whether that's a child or a veteran, family member. There is sometimes a stigma that asking about suicide increases the chance of it happening. It does not. So if someone has mentioned that they're having suicidal thoughts, if you do go forward and ask a question about it, it's not increasing the chance of harm. It's actually more effective to just ask very directly to screen it. So that is, asking about a plan is still an evidence-based practice.
Yeah, very interesting. And Mike, on that note, you've done some things where you were simply trying to interrupt the process. Talk to me about the gun locks, where, yes, I have a plan, I have a gun. Is there something then you could do that might maybe have them to pause?
So it's, the 2022 annual report for Ohio just came out this week. And across Ohio, firearms continue to be the leading cause of suicide. It is no different for veterans. Veterans are very familiar with firearms. It makes sense that firearms are the number one mechanism chosen. So if we can identify a veteran that has firearms, that owns them, there's a couple things we can do. Number one is we give out gun locks. We have gun locks in our lobby. We go through hundreds of them. If you take 5, I don't ask if you own 5. That's fine. Take 5. The theory with a gun lock is if you lock a firearm up, It's your right to own them, and that's great, and I fully support the Second Amendment. I own many guns myself. If you lock them up and use a gun lock, that creates space when somebody is in a mental health crisis, and it delays it just a hair. So now you've got to get a key. If you're in a crisis, you may be shaking, you might be a little off. It's a little bit harder to do, and that means that the weapon's unloaded. So we're not asking for anything other than if you've got some firearms, we'll be happy to give you a lock and consider putting a lock in it and keep it in a safe. So now we've got it locked up double and it's unloaded. So those extra steps can be very, very crucial for a veteran that is in a crisis, or really anyone that's in a crisis in the community.
Steve, I see you nodding.
Right. So let's break this down a little more. Veterans are more than likely to own firearms, much more than our civilian populace. That in and of itself is not enough as an indicator that the veteran is going to commit suicide. It's usually coupled with an attitude. You know your family member better than anyone else. And when it's coupled with depression, when it's coupled with the veteran becoming recluse from either society, family, or friends, when it's coupled with extra consumption of alcohol, there's usually going to be something attached with the fact. So just because this is going out to our greater viewing area, and there's a veteran out there buying a firearm, does not mean they're suicidal. All right, so I want the public to know that. Look for the additional signs that go along with that. You're going to notice a change in attitude, and that's where it starts. And then we can start coming down the line of the availability of options for the veteran.
And options are important. I think I'll take the ownership of, the media wants to blame the gun. And, we have a saying, if guns kill people, pencils make mistakes. There are other things and people behind those choices and those steps. One of the reasons we chose to have this today at Xavier University was that we have talked to veterans that have said, the thing that got me out of sort of my funk, for lack of a better word, was some kind of a new purpose. And many of them told us along the way that while they were in crisis, you got them through the crisis, but then they still needed a driver. They still needed something that said, there's more after my life of service, which is often with an education that they could pursue. I have with me a gentleman here who's with Xavier University. I just want you to stand, if you would, tell us who you are, and just share a little bit about why you made a decision consciously at Xavier to highlight veteran education programs.
Sure. I'm Scott Clyde. I'm the Vice President for Strategic Enrollment here at Xavier. And again, really wonderful to have this program here today. What I think is really important, and it's built into the mission of Xavier, it's one of the things that attracted me to come here 6 months ago, is this idea of Ignatian belonging, right? So it's connected to mission. And I think that's a lot of what veterans or just anybody that's part of a community, they want to feel like they belong to it, that they're a part of it. And so I didn't understand that term in the way that I do now, even 7 months ago. But it's one of those deep connections with other human beings that's important. I mean, Steve just mentioned it, right? If people start to retreat, I don't think that's unique to veterans, but those are some of those indicators and signs. So I just think giving back to my peers. I served 10 years active duty in the Marine Corps myself, and really enjoyed that community. My transition into higher education was a bit jarring, but I went to a place that I knew. My first job was at my alma mater, and that made that transition easy for me. So everybody's got some transition that they're navigating, and I guess if I could ask a question to the panel is, do you think there are things unique to colleges and universities that would help institutions like Xavier serve veterans in even better ways? Like, is there something unique to a college campus that might be helpful, or that veterans are engaged in education that would be helpful for us to know to even elevate our own service throughout the Veterans Center and beyond?
My perspective, there is, having done 2 degrees post my time in the Marine Corps, that universities will tell you we have a veteran program, but where is it? They'll tell you they have a veteran program and it's vibrant, but nobody's reached out to connect with that new veteran. Veterans are very good at playing the sniper. I'm stoic, I don't smile, and I put my back against the corner. I'm not asking questions, I'm going to class, I'm doing my work. it has to be a proactive community. The community has to, for administration, enrolling a veteran, there ought to be an automatic identification to the veteran populace on campus. We have new veterans joining, to find that individual, to bring them into the fold. Families, very important. Teams, very important to veterans. And I think you'll get to the core of a lot of issues to bring them into that family and give them that same family sense that they had while in the military.
Steve,
Glenn, you want to follow that?
I think Steve's spot on there. And a term comes to mind that we're familiar with in the military called intrusive leadership, which means as leaders, you're not passive. You identify the problem, oftentimes before the individual even recognizes that they have an issue. And your willingness as a university, as a colleague, as a leader, to take that first step and address that issue up front, and to be very candid about that. And that's where having a veteran community and a veteran presence on campus helps break down a significant number of those barriers, because there's an inherent trust and relationship among veterans. Even if you've never met the individual, you share a common background. And I think that's very helpful to your point about those veteran communities on campus, and to be visible, to be aggressive, if you will, in getting the word out about the resources and programs that we provide.
Marie?
Perspective. I was recently at Loyola University, and they have a veterans program there. One of the things that's going well here at Xavier is that those Ignatius values that were talked about before, one of them is the whole person. And so you're not just going after a degree, you're not just trying to restructure yourself to a new mission, which is you, and that's very foreign to military members, because the mission as the whole is the service. And so really here, you get to really challenge yourself in a creative manner of all facets. So it's really challenging that person to get involved in things and hobbies way outside of anything that they would ever possibly get involved with before. And I think also what's happening really well here is it's very student-led. And so what they're talking about, this community, no one better can understand another veteran than a student veteran that's also in classes with you. So it's just nice to see someone on campus and give them a smile, or connect with them and make sure that they're going to class. Something in healthcare that people talk about is the continuum of care, having multiple points of contact with that person. Here at Xavier, that happens. The professors are talking back to the center is talking with the veteran, and then the student veteran is following up with that individual, so that we really have an all-encompassing, care of that person.
And I think that has been a shift in healthcare in general. When I think about the people at Beckett Springs, you used to get a person in crisis and you would perhaps find a place immediately for them, and then what? And now you realize you have to follow up with the whole person, do you not?
We certainly do. So we have that inpatient program that I mentioned, but then we have that same Help for Heroes program specifically in partial hospitalization and intensive outpatient programming. So once somebody might be discharged from the hospital, they could then step down to a lower level of care, where they might come back to the facility either in Westchester or in Dayton, anywhere from 3 to 6 times a week for an additional 1 to 2 months in programming. And then upon discharge from one of those lower level of cares, we would set a person up with an individual provider to continue with one-on-one therapy or medication management if necessary. So the continuum of care is definitely a big deal. Oftentimes, I might tell somebody, hey, this is probably the hardest step. Yes, but then once you leave this program, then what? That follow-up is just as equally important. And I think sometimes, that initial ask for help is kind of chaotic, right? But then once you're more stabilized, then I think it's really important to have some kind of aftercare plan, so that you're not just right back into whatever pattern or situation that you were in when you first arrived.
And Mr. Farmer, I know you've had to follow up to get information. You mentioned FOIA requests to find out what works, but are you finding that? Can you follow some of the people in crisis and make a difference?
So our FOIA request, there's no identifiable marks on it, so that makes it challenging. And we don't really want to identify the specific. What's helpful for us when we can see how many calls either to the Butler County crisis line or to the Veterans Crisis Line nationally is it tells us a general volume. So we have a large piece of our budget that goes to advertising specific to suicide prevention. And so unfortunately, a lot of it is in the rears or post-vention, if you will, and it's after the fact. But for example, last year, Westchester, Ohio was the high mark with 5 veteran suicides. So we very specifically put billboards in that area for the crisis lines and for resources. So we're kind of using the data as a point of getting those marketing pieces and trying to assess, are the resources being utilized? So with veterans, not all veterans, but some veterans prefer not to use the VA. And Lisa's familiar with this, and so is the VA, and that's okay. If you have a mental health crisis, we want the veteran to know if the VA is not your choice or something went wrong years ago and you've got a bad taste in your mouth, there are other options. There are other resources. And we're very fortunate that there's now the Compact Act, which allows, and we could probably have a whole conversation on the Compact Act, but any veteran that is in an acute mental health crisis, having that urgent need of, feeling suicidal or mental health breakdown, they can go to any medical facility anywhere. It doesn't have to be the VA, and it is covered by the Department of Veterans Affairs. That treatment for that incident is 100% covered. They just have to say, I'm a veteran and I'm feeling suicidal or I need mental health help. And it is taken care of under the Compact Act. I know the Cincinnati VA has had thousands of claims all paid out under that since it rolled out a little over a year ago. So it's really important that we're, the panel here is very diverse, and we're talking about engagement with the student community. I would add that it's kind of ironic to me that we're having this at Xavier today. Xavier University has been the leader in student veterans affairs and their center since at least 2015. And it's where I started long back when Chris Klug, and it was in a small house, on the other side of campus, but those types of relationships can really give that sense of purpose to the veteran and give them comfortableness to either come to you or to go to the resource that you recommended, because it's coming from a trusted resource. Just yesterday we had a phone call in the office, and it was a veteran in crisis. Talked to a receptionist. She had passed it off to a supervisor, and it was about building rapport with the veteran. And to that veteran, his request was that myself or Commissioner Mark Applegate come to his house and talk to him that day. That was what he wanted. And why he felt connected was because he saw something in the media on a news story, and those were the two faces that he saw that was talking about veteran suicide that he was able to connect and relate to feel comfortable with. So this is all about relationships and engaging the students and finding their, when a veteran comes to college, it's a chance for them to develop and to go on with other skills in life. But more importantly, what are the other things? And she mentioned a few. There's clubs, there's hobbies, Student Veterans Association. Those key relationships for me, that's where I found out that my calling in life was to help veterans, was while I was a student veteran. And I ran into a crisis, and the GI Bill, back before things were kind of worked out, I had a utility shut off in the winter, and that was my income, was my post 9/11 GI Bill at Miami University. And there was no help. The VA just didn't pay. So I was in a mental health crisis and had nowhere to turn, and we don't have the supports at the university I went to that Xavier has. So kudos and nothing but good things for Xavier, because you are really leading the way, Glenn, and your efforts here to connect veterans. And that's what we're here today, is to connect veterans, have this open discussion, and realize that there are a plethora of resources, whether the VA or private. If you reach out, there's lots of help. There are individuals willing to help you. There are organizations. We just need you strong enough to say, I need help.
Well, and I think the difference is not just I need help, but that there are people who really care. As I'm listening to you, I can feel the connection, and I hope that many of you can too. Are there questions out here? Before I move on, I'm going to go to this gentleman here, but I do want to ask Lisa. One of the things I'm hearing from Mike, which I know has been a focus, is that your physical health is not different than your mental health. In other words, we used to mental health, you go here, and physical. The VA for a long time took care of the physical need, and we didn't hear a lot about that. Is that changing? Is that one of the goals?
It absolutely has. So in primary care, starting in primary care, we work with veterans on whole health, not just looking at your physical health, but how is your mental health, how is your body working, what is your weight like, and looking at all the individual pieces of that person, rather than just focusing on just are you suicidal. Though we ask that question, which I want to make a good point about the VA that I think has been wonderful, and that is we now screen every veteran once a year for suicidality. And I can tell you that we have come across some individuals who otherwise would not have said anything. They came to their primary care appointment and, for whatever their physical need was, and had never brought up that they had a mental health need. So this screening definitely, we know that veterans who have died by suicide have visited a medical provider within the last 30 days. So we know that this is a point where we could screen individuals and find out if they're suicidal, because sometimes they don't just readily tell you, you have to ask about it. So that is one thing that I think the VA is the leader in when it comes to looking and trying to find veterans who might be at risk for suicide. But we do look at the whole health of the person, whether it's their mental health or their physical health. So we have primary care mental health integration within our clinics in primary care. So it's not like, okay, so here's your physical health, now here's your mental health, you've got to go to another different location. They are embedded within that clinic. So if it comes to light that the person is struggling with a mental health crisis, we have social workers, psychologists right there within the clinic that can go walk right across the hallway and now work with that individual. Along with, we have lots and lots of programs. And what I have realized from being within the VA and working within the system is many veterans have never even registered for VA care. And so I spend a lot of time saying to veterans, you might not be in a crisis right now. Your family member might not be in a crisis right now, but let's get you engaged in care so that if that happens, you're already set up. Like, we can just right away help you and get you involved in the services that you need. I remember a couple of years ago, I actually had called a veteran who had called the Veterans Crisis Line, and he was 91 years old. And he had never registered for VA care. And so I started talking with him, and I said, you have services that are probably available to you. And he said, I didn't even know that. And so we got him engaged in care at 91 years old. So it really is a burden for me to get veterans to apply for care. If you think you're not eligible, you don't know for sure. So apply for that care. You can now do it online. You can find a response right away and know what you're eligible for, because 9 times out of 10, you probably are eligible for something and you're just not aware of it. So I always encourage family members and veterans, apply for the care now. Even if you're not in crisis, even if there's nothing you need, get involved now so that you know what services are available to you.
And you have people to call if you need them. Yeah, excellent. Sir, would you stand up for me, please? Tell me just a little bit about who you are and why you're here.
My name's John Sadler. I was in the Army from 68 to 71. When I got out, I started working at the Fernald Nuclear Facility. I was there for 21 years, and if anybody around here knows all the what happened with workers, and they had filed a lawsuit and won it, the residents won their lawsuit. And so I'm on the medical monitoring panel for the Fernald workers. And so anyway, as far as how we are connected with the veterans, a large percentage of workers that work in the nuclear industry in this country are veterans.
So you're asking about resources that they might have?
Yeah, that there can be some kind of connection that could help the nuclear workers.
We do have contacts with congressional liaisons specifically for veterans. So if they're filing claims under that and having issues, we can certainly open up congressional inquiries on that and get you the contacts based on, it would depend on what district the veteran lived in. But if you contact me, I'd be happy to get you the correct person that can help the veteran or family member with those claims related to Fernald. I'll give you a card.
All of
before I
our
leave.
panelists will be here, but also we will be sharing how to reach them as part of this program, which is really important. If you could stand for me, do you mind if I just hop over you? Okay, there we go. Yes, what is your name?
Hi, I'm Kristen Smith, and I work, I'm the manager of mental health promotion at Envision Partnerships, and the chair of the Butler County Suicide Prevention Coalition that Mike referred to. And that's an initiative of Envision Partnerships. And just recently, one of our members, she actually works for Beckett Springs. She's here today. Her name's Carissa Piper. She's been at a conference, and she let me know about some evidence that just came out that if people who have been treated are followed up with a note, that actually increases their chances of continuing treatment. And I've heard over and over today the sense of family and community that veterans have. And I just thought, what if, and I ask this to all of you, whether you're a mental health provider that could do this program, or maybe you have students that could write the letters, or people from a commission that could do the writing of the letters. What if veterans wrote letters encouraging, being the cheerleaders of the people that are in treatment after they're, go their merry way, hopefully, but many times they don't continue their treatment. And what if they're encouraged by someone in the family, the veteran, like a veteran, a personal note? I wonder if that could work. I guess questions for everybody.
So hold on before that. Who did you say was here that had gone to the conference? Is it you? All right, I just want to ask one follow-up before you answer that. So my question about that is, if you then had a letter, what was it specific to the letter? Was it the encouragement? What was it about that actually seemed to make the difference with research, if you would stand for us?
So the research had showed that if they had a letter from their physician or from someone a part of their treatment team within 3 months of them being discharged from treatment, that then the suicides within a year of the discharge were dropped in half. And
did they follow up? Did they say that's because they felt connected to someone who cared?
It's more about the connection and support.
Okay. Mm-hmm. So go ahead, follow that thought. Yeah.
The difficulty at times is sharing of the PII of the veteran, right? However, to establish maybe a mentorship group there of veterans who would volunteer, and then you could introduce the veteran you're serving to this veteran mentorship group, and now we're building relational accountability to feel they're part of it. A simple, do you mind if I reach out to you once a month, see how you're doing, take you to lunch, right? Again, it's working like the doctor's letter, but we're also defraying and pushing that individual towards the positive side.
So that's like the checkbox here, the same legal things we all run into. If you did that, then you'd have permission to reach out.
Correct.
Right, okay. Yes, ma'am.
I just wanted to say that I know the study that you're talking about. The VA has already started doing some of that. One of the things that we do is when someone has come to the emergency department, we send them what we call a caring contact, and we do that for 1 year. So we send it to them once a month, and it's not, it's not like your typical letter of, oh, you came to the emergency room, we're glad, all that. It's more about, hey, we just want to encourage you. We're hoping you're having a good day. If you need to reach out, here's the number. And it's just small, short contacts that are sent to the veterans who have come to the emergency room. So that's one way we're trying to impact it.
Interesting. So I know that all of you have spoken to that connection. We're down to about our last 10 minutes, if you can believe it, fastest hour in TV. But I wondered, as you're hearing things today and that connection theme keeps coming up. What comes to mind? I just kind of want to get that from each of you before we conclude.
I think about just the people we all have different contacts with, just that we all probably can reach different people. Not everyone is so open as this panel is about their veteran status, and so just this idea of how can we all support the people around us? How can we make that connection and be involved? I think just from what I'm learning today, you have to be in the community to get connected. So if you are, whatever you're connected to, that connection I think is very important. I think all of us have a role to play, including the people in the audience.
I would agree with you that veterans are completely shy about saying much in most cases. It's one of the things that makes them such amazing people of service. Yeah, absolutely. What do you do to connect?
Yeah, I think of two things. Number one of the biggest struggles as a veteran that's a student is trying to figure out how to communicate your service to the working world. And trying to translate that, even that language, is really difficult to communicate, those skills in that language. So really trying to work with veterans of writing resumes, trying to look for jobs. It's like the other world speaks Japanese and we're speaking French. It's very difficult to connect in that way. And then the second thing is kindness. You know, just being simply kind to these individuals. It doesn't have to be on a large scale, something so small of a hello or trying to just listen to this individual. A lot of the times when someone feels that you're being kind to them, they'll open up to you. And really just trying to lead that each day with veterans and people.
Mm-hmm. Yeah, well said. All right, I know you mentioned that you're reaching out with letters. I think the VA has made extraordinary strides in feeling approachable. Right. Is that sort of been that way to connect?
Absolutely. And I'll tell you what is really speaking to me right now is prior to COVID, we were the second VA in the country that started Hope Squad. Now, you've heard of Hope Squad for schools. Well, we have a veteran Hope Squad. But then when COVID hit, we kind of had to back out for a while and stop that program. And now we're getting ready to re-implement that program. Because what I found is, just out when I'm doing outreach, is a lot of times I would have veterans say, oh, here, can I help you with that? Can I help you set up the table? Because they want to be a part. And that's why my passion then was, let's start Hope Squad, because it gives them an opportunity to serve in a way that is meaningful to them, because they could go to outreach events with me and we would set up things. They also had we had classes for them where they could learn how to work with other veterans that might be in crisis, or they might see that they're having a mental health issue. And so I'm really excited because we're going to start that up, and that's really motivating me to get that going again, because I believe that's a way we can connect with the veterans.
Well, I will tell you at Local 12, I'd be honored as a medical reporter to help put the word out for that or share a story on it, and I'd love to do that, you know, working with your team. So if we can do that, you'll hear it here first. Mike.
Yeah, so I think the important takeaways here is the connectedness. And while I am operating kind of in the intergovernmental world and space of having a team that helps connects veterans to benefits, the community and the different programs within our communities, and I'm sure that some of the audience members can tell me about programs that I'm not even sure are happening. I see veterans represented that we've served at the commission. I see some that have very specific initiatives. I see some that have led gardening programs at the Cincinnati VA here. There are all different kinds of programs. Engagement in using a GI Bill. And perhaps you're past that initial GI Bill. There's a thing called VOC Rehab and education benefits. If you're a service-connected veteran, we can help you enroll and go back to school so that you can get meaningful employment that you're able to do with your service-connected disability. And beyond that, so if we enroll a veteran in education for whatever purpose, whatever program, that's going to connect him to these programs that those from Xavier spoke about. And, Steve said it best, some universities say they have a veterans program, but I will tell you that that's not the case. I could tell you firsthand, but I can tell you that UC, Xavier, and Wright State are leading the way in student veteran programs. So that sense of engagement, bringing it back to the holistic community. And remember that mental health, and we talked a lot about suicide prevention today, but it's really a whole health approach that Lisa mentioned earlier. And it's about the whole care and the sense of engagement in the community, opportunities for someone to feel like they're involved with you. So never look down on someone. There's always, we get great ideas from community members, and a lot of our outreach initiatives are based on that. But give everyone a chance to voice and hear them out, and do what you can. And if you don't know, maybe you can pass them on to a contact that can help them. And together as a community, it'll build us stronger, and it'll make us a better community.
I love hearing you just say that about Xavier, only because I know you are the person who says we're going to confront these directly. So you don't say things like that lightly. You really know.
I give that. I mean that wholeheartedly.
Yeah.
I won't name where I have personally had struggles and where they currently struggle.
See what I mean?
I'm aware, but Xavier and wholeheartedly, Xavier, Wright State and UC, they have multiple campuses, but they are very engaged with the veteran community. And their certifying officials typically do things on time, so we don't have a lot of problems. So kudos to Xavier for your engagement with student veterans and understanding the importance and the value of when a veteran comes on campus, often a non-traditional student, the challenges that they may face, and realizing that there may be a need for some additional programming or a sense for them to feel welcome and engaged as a non-traditional student. Having been there and done that and working in the world of Veterans Affairs now, it's very much welcome. So great job to Xavier and Glenn for what you've continued.
All right, Katie, got just a couple minutes left. Tell us about your thoughts on Connection.
I think coming from the mental health provider standpoint, connecting with facilities like the VA, when Mike reached out about the crisis line specifically, we want to know how we can help, right? So we are asking for resources from him so that when veterans are calling, we want to know how to respond correctly. We do have some veterans on our team, but we have a lot on our team who are not. So, we're hoping to reach out to the VA and get some kind of training specifically for our staff so that we're practicing within our competency and we're enriching our scope of practice so that we're able to provide accurate care, we're able to use correct language, we know the right ways to ask questions. I think using all of the resources that are around and working together, because all of these resources are here, when we're able to work together with one another, it broadens the community that we can impact. So.
Oh, no question. And we hope that those of you that are here will find the resource up here or reach out to us at Local 12 and we'll connect you too, because that's the key, that we have a community that cares. But if you don't know how to get to that resource, it doesn't help you. Yeah. All right, Glenn, tell us a little bit about your thoughts on Connection.
Thank you. Marie previously spoke about the concept of cura personalis, caring for the whole individual. And while I'm not a mental health professional, my sense is that when an individual gets to that point of being so hopeless that they're considering harming themselves, it's not one single issue, but it's a compilation of things. Things just continue to pile on. So I feel like we have an opportunity to engage with them on a social level where they feel like there's a sense of belonging, perhaps helping them out financially, whether it's through their VA benefits or connecting them with a potential employment opportunity. Their physical health, there's lots of opportunities like that here on campus. Just that whole range of things that if you can take one piece out of that circle, it makes a big difference.
Yeah. And just one could change a life.
Yes.
Yeah, absolutely. All right, some thoughts on Connection.
Thank you. So we've talked a lot about connectedness in the veteran. We've talked a lot about the campus society and connectedness of our veterans on individual campuses. But I want to break that down a little farther, though. Veteran definition. We talked about enrolling in the VA, getting VA health care. The definition of veteran varies whether you're going for VA health care or whether you served in the reserves. And I didn't activate for anything under Title X, we call it, for a war. Am I seen by the VA as the same? And that's no. So their benefits are thwarted from what an active duty military would receive. However, the 988+1, I want to break this down to the family. And because this is going out to our community, Liz, I want every household that watches this to understand. 988+1. I don't care what branch or in what status your veteran served in, active, reserved, inactive reserve, 988 plus 1. They will talk to you, the spouse. They will talk to the grandmother. They will talk to the veteran itself. You don't have to shove the phone into the veteran's mouth to make him talk. If you think they're having issues, they can help guide you either where to take them or how to start the conversation, because that's where it's got to start.
All right, so my final thought, Mr. Farmer, you said to me probably the single most important thing is that this impacts the family. So even as a family member, if I'm watching this today, I can dial 988, hit 1, and what happens?
So they're going to take some information. They're going to ask about your concerns, but they will be followed up on. So I can tell you for sure that calls to 988, they deal with the immediate crisis and the immediate situation, and then it's sent to the closest VA medical center from there, and Lisa Liston and her team follow up with every referral that they get. So reach out if you see something. We say in the community nowadays after 9/11, if you see something, say something. It's the same thing with mental health. Don't be afraid to reach out, because a follow-up phone call is not going to do any harm.
Yeah.
So let's get connected as a community and help decrease it together.
And at Local 12, we have that same resource, 988. Anyone can call that. But I just want you to take a final look at every one of these faces. One of the things they said is we're here mainly because we want a message, but we're here because we care about you and you and you. And we are grateful to have you here. Thank you, guys. Couldn't ask for a better conversation. If this changed your life today, please reach out and let someone know. The resources you can find sitting up here today at what'shappeninginhealth.com. We will see you back Sunday morning, 6 a.m. on What's Happening in Health. Until then, everybody stay well and stay tuned.
Veterans in the tri-state and across the country need help with wounds, both visible and invisible. Learn to spot the warning signs and how to get help for you or a loved one. Thank you for watching Local 12's What's Happening in Health Veterans Mental Health Forum. Sponsored by Butler County Veterans Service Commission, Claremont County Veterans Service Commission, and Xavier University's Captain Phil Bucklew Veteran and Military Family Center.